Welcome everyone to our another exciting episode of Dr. Dad Talk Show. I am your host Indu Bala from Dr. Dad, and today we have a special guest with us. Let's welcome to Dr. Sunita Verma, the gynecologist. Welcome ma'am. Welcome to our show.
Thank you so much for inviting me to your show.
It's our pleasure ma'am. So shall we start ma'am?
Yes, why not?
Okay. Our first question from audience is, incorporating exercise during pregnancy. Many expectant mothers are concerned about the safety and benefits of exercising during pregnancy. Can you provide guidance on the type of exercises that are safe as well as their potential advantages for both the mother and the baby's health?
Right. Exercising in pregnancy is very beneficial for both mother as well as baby. It is found that those women who are exercising throughout pregnancy, they are very active doing their daily household chores, doing prenatal yoga and all those things.
Okay.
They benefit in terms of having a normal delivery, also a smooth sailing pregnancy, and they generally have a better fetal or baby outcome. They are known to have better weight of baby at the time of delivery. Okay. And they are more able to endure the process of painful labor pains, and they are more likely to deliver normally if they are very active. Okay. And they are likely to have less pregnancy induced complications like landing in emergency cesarean sections or having diabetes or blood pressure or maybe a smaller weight of the baby. Though these things are found to be less in those people, those women who are exercising actively during pregnancy.
Okay.
Regarding the exercising daily, whatever they are used to do, they should continue doing that. They should not suddenly start doing vigorous exercises for which they are not used to, but daily walking, doing stretching exercises, some yoga asanas, some pranayam, breathing exercises, stretching exercises.
Okay.
Some yoga asanas are very helpful in doing a normal, helping in delivering a normal baby.
Okay.
Like this is Titli asana, Vajrasan and all those things. So those people who are actively exercising, they have a smoother pregnancy experience.
Okay.
They are more likely to deliver normally also, and they have better outcome in terms of baby weight and any other complications in pregnancy.
Okay. At what time they start the exercises, ma'am? Like 1 month or a second month?
They can start from the very beginning also, but generally we recommend they should go easy in first trimester.
Okay.
From second trimester onwards, they can do daily. They can do swimming, they can do walking, mild jogging. They should not be doing impact exercises or weightlifting or cardio types of things. And similar in yoga postures also, they should not be doing this Kapal Bharti type of things.
Yes,
but regular pranayam, some stretches, these things are allowed.
Useful.
Except when we have advised them not to do exercise, like those people who are having placenta previa, having bleeding pregnancy, or those who have bad obstetric history, like they had some miscarriages or some complications in previous pregnancies, or they are under treatment for preterm labor. In such patients, or they are having some heart condition or high blood pressure or whatever, some sort of pregnancy induced complication. Such patients should not be doing
the yoga exercises.
Yeah, exercises. But brisk walking or slow walking for half an hour, at least for half an hour in a day, is allowed in most of the cases, unless we have advised them a bed rest for bleeding or preterm labor or something like that.
Okay ma'am, thank you so much for your answer. The next question is, options for pain management during labor. Pain management during labor is a significant concern for many women. What are the latest options and techniques available for managing pain during childbirth, and how can women make informed choices about what's best for them?
This is a very age-old question. The pain management during labor, so many things have been tried for that, but nothing is very foolproof that you will not have pain. Even we can reduce the intensity, but it cannot be totally elevated, right? And we have non-pharmacological options also, where you are doing this massaging or acupressure or acupuncture and back massage and water therapy, hot fermentation, like these things.
It helps, ma'am?
These are said to some extent, not much, to some extent, but mostly the patients are aware of epidural anesthesia, delivery under epidural anesthesia, which is known as painless delivery. ठीक है, people can opt for this. Epidural has its advantages as well as disadvantages. In epidural, some patients they may not be able to walk around because your lower body portion, belly button down, is numbed. So they may not be able to walk around. They may have to lie on the bed, or they may find passing urine as difficult. Catheterization may be required. They may have prolonged labor also. Sometimes in second stage, when the time is there to push, the mother may not be feeling so sensations so as to bear down, so prolonged labor or instrumental delivery. These things can happen. Or it needs a constant supervision. Anesthetist has to be there, constant monitoring whenever the effect wears, but then you have to give more injection, because epidural, as you know, there is a pipe inserted in your spinal canal through which we are giving medicine gradually, and it is given after you go into active labor, like you are at least 3, 4 or 4, 5 centimeters dilated. So we have to wait till that time. When you are in active labor, then we give you epidural, and it almost you are not able to feel any pain when you are under epidural anesthesia. And suppose some need arises and you have to be taken up for cesarean, this same anesthesia will work for that also. So there are good points for epidural, some drawbacks also, but those people who are very afraid of going into pain, they can opt for epidural anesthesia. But these are the limitations. Like suddenly sometimes after giving epidural, your blood pressure may fall, which may impact your baby. Or sometimes this thing, you have to be confined to a bed, you may not be able to walk around. Although people are able to walk around, but some difficulty could be there. And instrumental delivery, thoda sa rehta hai chance for instrumental delivery also. Otherwise, pharmacological methods means by drugs, because we can give you painkillers and all, but they are not so effective. And those painkillers which are effective, we don't want to give you during labor because they may harm your baby. Okay, like opioids वगैरह, if we give you opioids, you will be relieved your pain to much extent, but it may cause respiratory depression in the baby. So we avoid giving such medicines. So basically, I think सबसे best option is you should be mentally prepared to go into labor. You should be having very good mental, emotional and physical health. If you are mentally prepared, you have been active in your pregnancy, you have been exercising regularly, having good meals, good nutrition, and you are practically not having many pregnancy induced complications, and you are determined and you are physically active, then I think you will be able to endure the labor pain. Some kind of analgesia is given in the form of medicines. Otherwise, one can opt for epidural also. It is patient's choice.
Okay, ma'am. Move to another question. It's maternal nutrition and fetal development. Nutrition is a vital aspect of a healthy pregnancy. Could you share insights on the most important nutrients and dietary considerations that can promote the optimal development of the baby and overall well-being of the mother?
Right. Nutrition is very important in pregnancy for both mother as well as baby. We'll start from the first trimester or before pre-pregnancy levels. Generally, we advise those patients who are planning to get pregnant, that they should start taking folic acid supplementation at least 3 months before they conceive, because folic acid deficiency is known to cause neural tube defects, some problems in the spine of baby or cardiac defects like this. And in first 3 months also, they are supposed to continue with folic acid supplementation. Sometimes in our diet, especially vegetarian diets, folic acid is not in adequate amount, whichever is required during pregnancy. So they should take sprouts, leafy vegetables, fruits, nuts and all those things, so as to have normal folate levels in their blood, so that pregnancy is uneventful. A baby doesn't have any such kind of neural tube defects and all those things. And later on in pregnancy or throughout pregnancy, basically we advise them to have high protein diet, nutritious diet which is high in protein, low in fat and carbohydrates. Okay. The animal sources of protein, you know, milk products, chicken, egg and all those things. And plant sources of protein are in pulses, dry fruits, nuts and seeds, sprouts and all those things, soya bean, paneer, milk products. So when I have already told you.
Yes, ma'am.
So basically they should focus on having good, nutritious, healthy, balanced diet which is rich in protein,
Okay.
minerals, amino acids and fatty acids, or omega-3 fatty acid food like almonds, walnuts and seeds and pumpkin seeds, sunflower seeds and
And
all
in
those things.
food, ma'am, banana is also very much carbohydrates in this.
Yeah, banana is good. It is a good source of manganese, potassium and
Yeah.
all those things.
Okay. And ma'am, nowadays women are like anemic. So I think banana also helps in this case.
To some extent, but anemia is of many types, like iron deficiency anemia or
Yes.
vitamin deficiency
Yes,
anemia.
ma'am.
Basically, women are mostly, especially in Indian scenario, there is iron deficiency because our diet is not giving us adequate amount of iron.
Okay.
And then there are some concern about digestion, absorption also.
Okay.
So basically, those who are anemic, we advise them to have leafy vegetables. Cheapest way of having iron in food is make food in iron vessels.
Okay.
And take dry fruits, black chana, good. These are good sources of iron. Dates are also good source of iron, anjeer, kishmish, all these things, they are rich in iron.
Okay.
To some extent to banana also, but not as much as the other things which I have told you.
Right.
And they should have with this they should have fresh fruit, salad, vegetables, dal and everything. So there should be a balanced meal. So that every ingredient is taken care of.
Right.
Because if mother is healthy, the baby is going to be
Right,
healthy.
right, ma'am.
If she is
That's
anemic,
right.
baby is also being affected.
Yeah.
Pregnancy induced complications are going to be more. So nutrition plays a very vital role in having a healthy mother and child.
Yes, ma'am. And ma'am, which food is like not good for baby and as well as the pregnant woman?
Obviously, high calorie food, too much of fatty diet, too much of
Okay.
sugary things, these are not good.
Okay.
Most of the processed food and all, we always advise that they should have a home cooked balanced diet.
Okay.
Sometimes it's okay, but it should not be overdone that you are taking lot of processed food and all those things. Once in a while is okay.
Okay, ma'am. Okay. Now we have our next question. C-sections versus vaginal birth. The debate between cesarean sections and vaginal birth continues. What are the key factors women should consider when making this decision, and how can they prepare for either scenario to ensure a safe and healthy birth experience?
Okay, everybody wants to deliver vaginally, including doctors. We also want patient to deliver vaginally. Okay, but there are few conditions where normal delivery is not advised straight away. There is no role of even trial of labor also, like placenta previa, whether the placenta is low lying. Such women cannot deliver normally, or there is abnormal presentation like breech, bacha ulta hai, aada hai, isn't it? There is multiple pregnancy, twins hai. In some few of such cases, there is a disproportion in the size of pelvis and the baby's head size. This is known as cephalopelvic disproportion. These are the things where normal delivery is not advisable. It cannot be done. It should not be done.
Right,
Okay. In these cases, there is no choice for patient. She has to decide for cesarean section. Rest of the cases where she is fine, she is not having any medical condition like too much of high blood pressure or sugar, or maybe maternal factors like blood pressure, sugar, and fetal factors like baby is in jeopardy because of low weight. There's less of fluid around baby's color Doppler is not good, baby is not healthy inside the uterine cavity, so it's decided that baby should be taken out, or some liver conditions are in mother like IHC. In such cases also, for maternal or fetal conditions, we have to opt for cesarean section.
Okay.
Rest of the patients, they can go into labor, they can deliver normally also, but many a times, despite being everything normal, that we are also very sure that she is going to deliver normally.
Okay.
But any complication can arise during labor, like fetal heart drops, or there is no progress in labor, or no descent of the head during labor, then such patients have to be taken for cesarean section.
Okay.
So for patient to decide where we advise them that it's not good for you to go for normal delivery, there they have to go for cesarean.
Okay.
Rest of the patient, they can fairly go for normal delivery. During labor, whatever is the outcome, the decision is taken.
Okay.
So till a woman delivers normally, 100% nobody can say at any stage that she is going to deliver normally only.
Okay.
So I think there are few patients who do not want to undergo the pain of normal
Yes,
delivery.
ma'am.
They opt for cesarean section directly.
Yes.
That is also allowed sometimes,
Okay.
if a patient is not willing for normal delivery. So I think this is the scenario which all patients should understand.
Okay.
That there are few conditions where normal delivery cannot be done.
Okay.
And those people who are more likely to deliver, as we have answered in other questions, those who are very healthy, mentally, physically fit, emotionally stable, and mentally well prepared to undergo labor, and not having any medical complications or fetal complications,
Okay.
those people are likely to have normal delivery.
ओके और मैम मैंने सुना है कि जैसे सिजेरियन के बाद कि काफ़ी लाइक ओबेसिटी की प्रॉब्लम हो जाती है. Is it true?
No, it's not like that.
ओके क्यों कहते हैं कि पता नहीं सिजेरियन होने की वजह से ही शायद ये ज़्यादा स्टमक वगैरह काफ़ी फूल जाता है और बड़ा टाइम लगता है उसको.
No, they don't. They should start exercising after 6 weeks of delivery.
Okay.
Then they will not have this problem.
Okay, ma'am. Move to our next round. It's a postpartum mental health. Postpartum depression and mental health are significant concern for new parents. What are the signs and symptoms of postpartum depression, and what support and resources are available for mothers who may be experiencing these challenges?
Okay. Postpartum depression is quite common, say around 20-30% patient might experience this. The people who are more prone to have postpartum depression are those who have family history, or those who have had depression in the past, or some bipolar disorder, or like this kind of history. They are more likely to go into postpartum depression. So we should be aware. It's many a times there are baby blues for first 2 to 3 weeks, because suddenly there is a change in their routine. They are not able to sleep. There are a lot of demands on them for feeding baby. Baby is not sleeping, and they are overworked, tired, lack of sleep, and not properly able to eat, and everything is there. Those people who have had difficult pregnancy complications, multiple hospitalization, they are already so much stressed out. This additional burden, it becomes too much for them.
True.
So they become sad, depressed, not able to sleep, or they are sleeping too much, or they are losing their appetite, or eating too much, or having any hallucinations, delusions, suicidal thoughts, thoughts like to harm their baby or themselves. And this depression in the women, this transfer to the spouse also, to the family members also. So it negatively impacts the baby's growth also.
Okay.
The women who are depressed in postpartum period, the spouse is also depressed, the baby also gets these vibes, and baby also develops inadequate negative environment. Baby is being exposed to negative environment, so it impacts their mental and physical growth also.
Okay.
So we have to be vigilant. If a patient seems to be depressed, not interested in baby or the surroundings, or she is not enjoying those activities which she used to enjoy earlier, not able to take sleep, not eating properly, and all this, then she should be consult. First thing is psychotherapy.
Okay.
She should be consult. She may be having some problems at her home environment. Spouse support is also important in such patients.
Right.
Social support is also important. Sometimes there are only two of them, and they are taking care of the baby,
Right,
not able to
right.
sleep, eat. So it causes a lot of stress on both.
Yes.
So we have to do counseling. Psychotherapy is the first answer.
Okay.
See what is the reason, whether there is endogenous depression or it is because of circumstances. There is no social support, no mates, no one like this. So if psychotherapy doesn't work out, then we have to advise them antidepressants also, so that it doesn't reach to a stage where they think of harming themselves or the baby. Some patient, they may, if they are neglected, they may progress to the stage of postpartum psychosis, where they start getting hallucinations, delusions, and hearing voices and all, and then think of harming themselves or baby and all those things. So postpartum health is very important. For that also we should be vigilant during pregnancy also. So if we find any symptoms that this patient may go into depression, or she seems like having difficult pregnancy, or household environment is like this, social support or financial problem is there, and any emotional issues are there, any untoward incidents have happened in family or during pregnancy or in the past. So we should always take care of her, do her some counseling every time, so that we prepare her for the things to come. so that when she delivers, she is not afraid of
Right,
delivery as well as taking care of baby. She should be well prepared mentally and emotionally also, and should be confident. Should not have so low self-esteem that I'm worthless, I'll not be able to do, like having guilt, I'm not able to take care of child or feeding or
ma'am.
she should not have, because everybody has to go through this.
Yes.
If you are mentally prepared for this, you will go through it nicely, smoothly and happily.
Okay.
I think this is the very important thing, postpartum depression.
Right.
Because many a times people and the family members, they are not aware of this.
Right.
They may not be able to judge that she is depressed or she should be taken to a doctor and all those things. So early help should be resorted.
Okay. Okay, ma'am.
Timely referral to a psychiatrist if it is not being taken care of by psychotherapy alone, it should be done.
In your career, you have such a go through this kind of cases, ma'am?
Yeah, it happens. Not so common, say around 10, 20 or maybe 30%.
Okay.
Not very common, but it does happen.
Okay. Right, ma'am. Thank you, ma'am. Thank you so much for your valuable time. Any takeaway message that you want to share with our audience?
Yes, the takeaway message is star of all your questions. Number one, they should plan pregnancy when they have between 25 to 30 is the ideal age, I would say.
Okay.
Too early when the women is very young is not so good in terms of pregnancy outcome. Similarly, if they have become like 35 and above, still they will have more problems. So they should plan pregnancy at the right time.
Okay.
And they should be mentally, physically ready for pregnancy, and they should start taking folic acid supplements before they plan pregnancy.
Okay.
And throughout pregnancy also they should keep a good attention to their proper diet, nutrition and exercises. And when they are planning pregnancy, they should not take any harmful substances.
Okay.
No drinking, smoking, X-ray, medication, because if it turns out to be that you had taken some harmful substances and then you are pregnant, then it's a problem. So if you are planning, take folic acid supplementation, avoid harmful substances and have good nutrition, good physical activity and a positive attitude of mind, so that you have a very smooth and enjoyous parenthood journey.
Yeah, that's true, ma'am. Thank you so much, ma'am.
Thank you, Indu, thank you.
So it's time to wrap up today's episode of Dr. Dad Talk Show. Our viewers, thank you so much for joining us. I hope you found your answers today, and please don't hesitate to catch us. Bye bye, take care.